Hi, my name is Sarah Lamp. I am a graduate student at Texas Tech University. I'm also an athlete here on the Texas Tech track and field team as a runner, and I'm going to be talking to you guys about the key issues in the female athlete triad. So, as an athlete, especially a runner, I'm excited to get to talk to you guys about this because it is very important for any female, especially female athletes. So, I have this poster board here to help me demonstrate to you guys how the female athlete triad works, and I hope this visual helps you guys get a better understanding of the concept. So, I am making this video to spread awareness to young female athletes on how serious the female athlete triad is and the importance of being knowledgeable on the topic if a female athlete wants to succeed instead of hinder their performance. So, the triad can result in declining physical performance, as well as medical and psychological morbidities and mortality. For starters, I will be talking to you guys about the female athlete triad and the background of it. There are three parts to the female athlete triad, and I will be going over each individually, how they relate to each other, and female athletic performance. So at the end, I'm going to recap on everything I had talked about just to make sure you guys understand the concept because it is very important. So the big question: what is the female athlete triad? The female athlete triad is defined as the combination of disordered eating, low energy availability, amenorrhea, so menstrual dysfunction and irregular or loss of a period, and low bone density and osteoporosis. So often this disorder goes unrecognized in female athletes, but it can be very dangerous and result in fatality. So the female athlete triad is often mentioned as a pyramid scheme, and individually each disorder can lead to the other. So as you can see here, low energy availability and disordered eating usually leads to menstrual dysfunction, which leads to osteoporosis. So the first disorder, and primarily the first cause that I just talked about, causes the female athlete triad is disordered eating or low energy availability. So, disordered eating has a broad range of harmful behaviors. This can include anywhere from food restriction to binging, eating a lot at one time, and purging, so self induced vomiting or throwing up, to lose weight or to have the optimal thin physique. This really affects sports like gymnasts and runners, where having a thin physique for a gymnast, as part of what they're doing, the look is everything. So some of the names of disorders and are correlated to disordered eating are anorexia or bulimia nervosa, binge eating disorders, and endos, so eating disorders not otherwise specified. So anorexia nervosa is characterized with an unwanted fear of being overweight. Someone with this disorder will have symptoms of trying to maintain a below normal weight through starvation, so not eating enough, making sure they're not eating, or too much exercise, over exercising for how many calories you put in your body. And then bulimia nervosa is characterized by an obsessive desire to lose weight and can include extreme overeating, followed by self induced vomiting, purging, or fasting. Binge eating disorder is characterized by recurrent episodes of eating a larger amount of food very quickly. This could be eating very rapidly than the normal person, eating until feeling uncomfortably full, and eating much more than the average person does in one sitting. Endos is characterized as individuals who do not meet the criteria for anorexia or bulimia nervosa but still have a eating disorder. So this disorder is just as dangerous as anorexia or bulimia and just as critical. These disorders for an athlete are very harmful, especially because the body needs fuel to operate and do specific functions athletes are required to do. And athletes are required to do a lot, and they ask a lot of your body, so you need as much fuel as you can get to do these specific functions. If not, this could lead to poor performance. So these behaviors can result in low energy availability. Energy availability is defined as the amount of energy remaining for the psychological functions after energy is expended in exercise training. The consequences of this may distort psychological mechanisms for cellular maintenance, thermoregulation, growth, and reproduction. Importantly, Low energy availability may occur with or without eating disorders and or excessive energy expenditure during exercise without compensation through dietary means. For female athletes, this low energy availability due to dieting coupled with excessive exercise suppresses the reproductive system in women. Low energy availability will eventually lead to menstrual dysfunction or irregular or loss of a period. So, menstrual dysfunctions can include exercise induced amenorrhea, secondary amenorrhea, and oligomenorrhea. These are all factors that can be seen in female athletes. So, during a normal menstrual cycle, the estrogen levels rise. Irregular or stop in menses disrupts estrogen production, and irregular estrogen levels can result in amenorrhea, which is having three or less menstrual cycles in a year in girls who have not begun menstruation by the age of 15. A typical number of menstrual cycles a year would include around 12, since there are 12 months. So secondary amenorrhea occurs when a female has had at least one menstrual cycle, but it has stopped for 3 months or longer. Oligomenorrhea can also occur from irregular menstrual periods. It's a female who goes more than 35 days without menstruating, and a normal menstrual cycle usually occurs every 21 to 35 days. So, since amenorrhea can alter estrogen levels, it may signal the onset of estrogen deficiency. Estrogen deficiency can adversely affect peak bone mass, which will result in the risk of osteoporosis. So, osteoporosis is a disease which the density and quality of bone are reduced. The consequences of lost bone mineral density can be devastating for the female athletes. Stress fractures and broken bones occur more frequently, and that is never a good case for an athlete. Any stress fracture, or broken bones can set an athlete out for months at a time, and you have to do rehab, so you'll never get back to your full potential until months later. And then loss of bone mineral density may also never be regained. So, in result, osteoporosis will occur when there's a loss of bone tissue. It is important to enter adulthood with as much bone as possible to prevent osteoporosis from happening. Young female athletes diagnosed with the female athlete triad have low bone density similar to an older woman, around 50 and 60 years old, which is not good. No one wants that at a young female age. It is important during the growing years to maintain good habits during the critical bone building time. To sum up everything I just explained, the female athlete triad is critical for young athletes to know. The 3 key issues that consist of the triad are low energy availability and disordered eating, menstrual dysfunction, irregular or loss of a period, and low bone density and osteoporosis. So each issue intercorrelate with each other. That's why it's called the pyramid scheme. First, starting with low energy availability and disordered eating. Like I mentioned before, as an athlete, your body needs fuel to operate and withstand the stressors a sport asks of you and puts on your body, which is a lot. By under eating or over exercising, binge eating, purging, this will all result in low energy availability and will cause irregular estrogen levels, resulting in menstrual dysfunction in a female. That can cause amenorrhea. So, estrogen is one of the primary causes of peak bone mass. And if a female is not ovulating or having a menstrual cycle, there will be estrogen deficiency, making it very hard to gain bone mass. That will result in osteoporosis, and we do not want that. So again, I am Sarah Limp, and I hope you are all able to understand it's very important for a female athlete to understand the consequences of the female athlete triad.